Hello everyone, I'm Dr. Apurva Satish Amarnath. I am working with NOAA IVF Fertility at the Counselling branch as a fertility consultant. So today we are going to talk about how couples can manage their work life in the fertility journey. So one of the usual questions that we get asked is, do we have to quit our jobs or not work during fertility treatment itself? And do we have to stay at home at all times, and whether the treatment is going to be extensive or painful and things like that. So one of the most important things to remember is we are not trying to disrupt your life. We want you to continue doing things as you were doing before, because sitting at home and leaving work would basically increase your stress levels and you would have nothing else to think about other than the fertility treatment. So some of the things that you can do is, as a couple especially, please do communicate with each other regarding what you're feeling. That is very important. Secondly, there is no need for you to leave work or really take a sabbatical from work as such. Only the days you require admission to the hospital are days you'd have to not work because your physical presence would be required at the hospital. Injections can be taken on your own if you can, or you would just require a visit to the hospital to take the injections that are required. And taking off from work basically puts you in a higher stress situation because you're constantly thinking about fertility treatment and what the possible outcomes would be, and that's not the best thing to do. Now, in case your work is very high stress or it involves a lot of extensive travel, do try and see if you can move to a relatively easier side of your job. Other than that, there is no rest that is required as such. And there is actually quite a bit of counseling that is required during the fertility journey. So counseling during treatment, before treatment and after treatment, all of it is required to make sure you are at ease in terms of your work life, in terms of your personal life, and regarding all the psychological ramifications of fertility treatment itself. At NOAA, we have an entire psychological counseling team that would help you out with this so that you are on the right track psychologically to go ahead with treatment and pregnancy later when it happens.